friends. I'm Dr. Molly. I'm a small animal veterinarian near Nashville, Tennessee. And this is a show for people who love their pets, like to laugh, and realize that life is hard, but dogs and cats help. I love veterinary medicine. I'm probably already obsessed with your pet, and I want you to understand more about both of those things. So, welcome to the Dr. Molly Says podcast. Hello, friends. I say, hey, friends, at the beginning of the intro, but it's such a scripted thing. I forget, and I say, hey, friends again. So, hey, friends. I hope everybody had a great weekend this past weekend. I went to Knoxville. So if you don't know this about me, I do live in Nashville. I went to Tennessee for undergrad and vet school. And my husband Ryan played football at Tennessee. And my family was just like a big Tennessee family. So we're huge Tennessee Vols fans. If you don't know SEC football, Tennessee football, go Vols. So we played Georgia this past weekend, which is a big rival game. And Georgia's a good team. And we seem to be a good team this year. And it was a close game. We went to overtime. Georgia ended up winning. It was very tragic for Tennessee fans. But I did get to meet a social media friend, Dr. Betsy Grunch, Lady Spine Doc. Shout out to my friend, Lady Spine Doc. We finally got to meet in person. We've been chatting on the phone for a few months now. I've been kind of helping her with some stuff going on with her dogs, and we've gotten to be friends. So it's fun to actually meet her in person. So I had a good weekend. I am slightly lost my voice because of screaming at the Vols at the game. So please forgive me. I was watching the game, and the Tennessee mascot is Smokey, who's a blue tick coonhound. And then Georgia's mascot is Uga, who's an English bulldog. And so I made some jokes about how Smokey would say the other team's mascot can't even breathe. But then I got to thinking how funny it would be if I did like a dog breed or animal video, like my dog breed videos with all the big college football team mascots, like if they were actually talking at the game. So anyway, sneak peek to my next crazy video. I have a hot take real quick before we get into what we're talking about today. So my hot take is, if your dog takes trazodone for car rides, storms, any kind of stressful event in life, please, please, please also give them trazodone for vet visits. Because no matter how friendly we are and how fear-free we try to be in practice, it's still stressful to go to the vet's office, right? And so if your dog if your dog needs trazodone or your cat needs gabapentin for stressful things, just please add a vet visit to the list of stressful things that they need that medication for, okay? We see patients a lot, and owners will tell us in the history, yeah, they take trazodone sometimes for stressful things. Did you give it to them today? No. Today is stressful, I promise. Okay, so give the meds. That's all. That's my hot take. I had another one. What was it? I don't know. It left me. If it comes back, I'll tell you. It was something from today. I don't remember what it was. Okay. Hello. Today, we're going to talk about vaccines some more. Have we talked about vaccines yet? I don't know, but we need to talk about some things for a couple of reasons. I've posted about this a little bit. For a long time now, there's been a lot of talk on the internet about, obviously, I know vaccines for humans. We're not talking about that. We're not touching that with a 10-foot pole. But it has some vaccine hesitancy and misinformation has translated over into the veterinary world and the animal world. And so there's a lot of talk out there on social media, online, about vaccines for your pets, which is why I wanted to just get on here and let's dive into it, because I posted a little bit about rabies vaccination this last week or two and gotten a lot of great feedback and questions from followers who are like, I actually really don't understand XYZ about vaccines. And they're not like anti-vaxxers, but they're just like, this raises some questions that I don't actually know the answers to. So I decided, great, we're going to just talk about it. So what I want to talk about today is really just giving you pet parents, pet owners, some scientific information in layman's terms for you to understand what are vaccines, why do we give them, what are they doing, and what does all of this mean that everyone's talking about? Because a lot of the people that are talking about vaccines for your pets in a negative way and telling you not to do it or not do it the way your vet tells you to do it, realize they don't actually completely understand how vaccines work and why we do what we do. And then that gets passed on to the person that heard it, and then they comment a version of what they heard, and that really doesn't make sense. And that's what I witnessed with that post about rabies. So I think we should talk about it, and I hope this is helpful just to kind of understand what's going on. And these are some things that, like, you may not even know how to ask your vet these questions, and so I'm going to answer them before you even have to ask them. So we're going to start with square one. What is a vaccination? What are vaccines? And everything I'm going to tell you is in the context of veterinary medicine and my patients, which are right now dogs and cats, but horses and cows too. So vaccines are injections that we give. They aren't medication. They're a tool. It's a treatment that we inject. They do come as a liquid. We either inject them in our pets, we inject them under the skin, so in the subcutaneous tissue where they get absorbed, or some vaccines are actually given orally or intranasally, and they get absorbed in the mucosa, so the tissue in that area. And you're going to think of the kennel cough vaccine when I say that, because we do give that one orally or in the nose, mainly because that's where a lot of the kennel cough disease happens. So we get better protection when we actually give it there in that mucosa. So vaccines, the way I think people should kind of rearrange their mind to think of vaccines is that they're a tool that we have to basically train our patient's immune system. Okay. So the point of a vaccine is to, one way or the other, which we're going to get into, introduce a virus or part of a bacteria to a body's immune system to show them one of a couple things, so that that immune system is prepared then when they encounter that virus or that bacteria or that toxin or venom in the wild. Okay. So if we train the immune system either how to protect against this disease or what it looks like, or a combination of both, that's what provides that immunity and helps the immune system fight that off down the road when that mammal actually comes into contact with the actual disease. Okay. And so there's there's different ways to do that. There are different types of vaccines. So I'm going to break them down for you because I do think this is important to understand. But antigens, so there's a couple terms you need to understand. So antigen is the actual pathogen. Okay. So antigen is the actual thing that is the bad guy, right? So the antigen is that foreign virus, bacteria that is attacking the immune system. Okay. And the immune system in all bodies creates antibodies to fight against that antigen. Okay. So the antigen is the attacker and the antibodies are the defenders, is the way you should think about this. And so what happens is when we give a vaccine to a patient, that introduces antigen. It exposes that pet's immune system to an antigen. And there are special cells in the body. The immune system is amazing. I would love for y'all to go to this part of vet school because it really is fascinating to really learn exactly how the immune system works. But I'm going to try to explain it to you. So there are cells, dendritic cells, these communicator cells, basically. They recognize the antigen and then they present it to lymphocytes, which are a really important part of the immune system. So there are different kinds of lymphocytes. So when an antigen is exposed, or the immune system exposed to an antigen, it sees that there are B cells and T cells and memory cells. And these are all types of cells that make up the immune system, and they react to that antigen that gets presented to them, basically. So they each do a unique thing in response to that antigen. So the B cells are what make antibodies. And so antibodies are those defenders. They circulate through the system and recognize that attacker, the antigen. And then T cells help the B cells. And then certain types of T cells actually kill infected cells with that disease. So they're really the fighters. And then memory cells are actually B cells and T cells that live a long time and they remember that pathogen so that when the patient gets exposed to it again, the immune system can have a rapid response. Okay. So you just really need to remember that a vaccine introduces an antigen to the immune system so that B cells, T cells, and memory cells, or some of them, will do their job, so that within a few hours of giving that vaccine, that immune system is already prepared, already creating a defense system against that pathogen. All right. So that's like big picture what's happening when we give a vaccine. There are three main types of vaccinations that we give. And I do think this is important to understand. So bear with me. I know we might feel like we're in the weeds, but I promise we're not. So that's the goal with all of our vaccines, and there's different ways to do it. So the first type of vaccine we're going to talk about is what's called a killed vaccine. So a lot of our rabies vaccines are killed vaccines, or you might want to think about it as an inactivated vaccine. So the actual organism that vaccine is introducing to the immune system is completely dead. So it's a killed version of rabies. And so it can't replicate, which is why when we give a rabies vaccine to our patients, it cannot give them rabies. Okay, so it's very safe in that way. None of our vaccines will actually give the virus to the patient, but killed vaccines are very safe because of that. They do require adjuvants as part of their ingredients because that's what boosts the immune system, because we are giving a weakened version of the virus. So because it is killed and inactivated, we get a strong antibody response, but because of the way the immune system reacts to it, the T cell response is less. So rabies is our most commonly given killed vaccine. There are some feline leukemia vaccines that are killed, but rabies is really the one we think about the most when we talk about a killed vaccine. So then the next category is called a modified live vaccination. And these are live versions, alive organisms of the pathogen that we're introducing to the immune system, but they're weakened, and the scientific word for that is attenuated. And so they can replicate, but only enough to mimic natural infection. They don't actually mount a true infection of that virus. So again, they're very, very safe. They're not going to give your pet what you're vaccinating them against, but they do generate a more robust immune response. So antibodies as well as T cells, better than a killed vaccine. And so some of the big vaccines we think of are your like distemper parvo combo. Those cover distemper virus, parvovirus, adenovirus, and then feline panleukopenia is another one. The intranasal bordetella is one as well. And so these are just more robust vaccines. They're just really giving the immune system a very, very accurate picture of what that pathogen looks like so that it can mount the most prolific and accurate defense against it when the body comes into contact with it later. And then the third category of vaccines is called recombinant vaccines. And this vaccine is called this because it's about the way that it's made. So it's very cool. It's very unique. It's created with some genetic engineering. So what happens is these vaccines are manufactured by taking a harmless vector. Canary pox virus is one that's commonly used, and they insert the gene for a specific antigen, which is the actual pathogen we're protecting against, into that vector. So basically, the way I was explaining this in vet school is that like canary pox virus is kind of like a Trojan horse. Okay, so they insert the gene for the antigen that they're protecting against, but it's hidden at first by that canary pox virus. So what it does is it stimulates a very targeted immune response without using those adjuvants that are used in like the killed vaccines. And so it's considered a very, very safe vaccine, especially in like immunocompromised pets. You may have heard of the PureVax feline cat vaccine. So these are recombinant vaccines. There is a rabies, feline leukemia. There is a recombinant Lyme. And so it's kind of like a simulator for the immune system. So it's not really presenting that live virus like a modified live, but it's getting a similar response. So those are the three main categories of vaccines. So I hope that makes sense. I tried to give you that information in sort of layman's terms. So that's what we're doing when we give a vaccine to our patients. One question that came up surrounding my post about rabies and rabies vaccination is this ridiculous concern that is being spread online that we should not be giving our patients that weigh different amounts the same volume of vaccine. Okay. So let's just nip this in the bud right now. Okay. That is complete that is bananas. All right. That is not a valid concern. That is just not how vaccines work. So I understand why people get confused about this because we do most medications in medicine, human and animal. We dose the medication, right, by milligrams or meters squared. So, especially in animal medicine, we do calculate how many milligrams of this medication a patient should get based on their weight. And that's because whatever medication it has to cover their actual body size, right? So there's a dose. But vaccines don't have a dose because we're not giving them in the vein. We're not circulating a dose for the body size. The immune system does not have a size, right? So the immune system is a cellular system and we don't need to dose. There's no way to quantify how big a patient's immune system is. Does that make sense? So I kind of think about it like a smoke alarm. There's a smoke alarm is a smoke alarm. Some smoke sets it off, but it doesn't really have to do with size. So the immune system does not have a size. And so vaccines don't have a size. Does that make sense? So it's not weight based. And the actual volume of the liquid that we give as a vaccine is anywhere from half a mil to 1 milliliter. And if you have no reference for that size, it's way less than a teaspoon. So I think a teaspoon is 15 milliliters. So it's a tiny, tiny amount of liquid. And companies that manufacture vaccines, the way they come up with that size is they determine how much vaccine needs to be made to stimulate the immune system in dogs or in cats, period. So again, it really has nothing to do with weight. You are not hurting your pet by giving them the same. If you have a small dog, giving them the same volume of vaccine as a giant dog, because that's just not how they work. It's the same in people. So a vaccine is a vaccine is a vaccine. So your dog doesn't need less. If they're going to have a reaction to a vaccine, it's not because of the volume of vaccine that was given. And this is well established there aren't in the literature just because that's how vaccines work. And the very, very smart scientists that developed vaccines and create vaccines, they know that because that's how vaccines work. So I don't know why or how that got started. I do think that there were some veterinarians who started this sort of idea. And it's too bad because part of this discussion about rabies was someone reached out to me and said, I heard a veterinarian say XYZ about vaccines. And it's true. There are some veterinarians out there who are spreading misinformation about vaccines and pet food and other issues. And that's frustrating. Something I said on my page this week was, you can find an expert in any field to confirm what you think should be true, if that makes sense. So if you feel for example, pet vaccines should be dosed based on size, then you can probably go out and find a veterinarian who is saying that. And we call that confirmation bias. But if you look at what the vast, vast majority of the veterinary community says and believes, that's not what they are saying. And so, you can find someone to support an idea that you have for the most part, even in a field like veterinary medicine. But if the entire or the majority, 95% of the community agrees on something, that's probably what's true, at least for our community of veterinarians, I can see. So yeah, just a little tidbit about that. That's why it's not weight-based. You do not need to be concerned about that. Something else someone asked was, why do we give puppies and kittens so many vaccines in the first part of their life? So this is a great question, and there are a lot of reasons. So puppies and kittens do get vaccine series. So especially for CVR vaccines and distemper parvo combo vaccines, those viral combo vaccines, puppies and kittens are going to get those every 3 to 4 weeks or so for a series of 2 or 3 vaccines, depending on when they start. And a big part of that is because kittens and puppies will have maternal antibodies from their moms, right? And so those are working on their systems from being in the womb. And then those start to fade as they get older. And not every pet, puppy, or kitten is going to fade that at the same rate, right? Because they're mammals are biologic beings. And so it's hard to predict that. And so basically what we're doing is we're introducing those vaccines and those antigens to those patients in a series as their maternal antibodies wear off. And so that's another reason why your veterinarian may and should recommend that your puppy or your kitten get those vaccines as a series until they're about 16 weeks old, because that's when we're pretty confident those maternal antibodies are gone. And so we know that your puppy or your kitten is going to get a full immune response to the vaccine so that they are fully protected. Maternal antibodies will actually block the proper response to the vaccine. So that's why we do that. We're just ensuring that they're getting some really good protection as the protection from their mom wears off. And then we do booster a lot of our vaccines, right? And so there's definitely talk about this. When should you booster? What boosters are necessary? And people have complained to me, well, every vet says things a little bit differently. And I completely agree that that can be confusing and frustrating. So where your veterinarian is getting their recommendation for vaccine schedules kind of matters here. This changes. So the veterinary community, this is another PSA, does not want to, I don't even like this term, over vaccinate your pet. This is another myth. I have never heard of any veterinary hospital or system or program rewarding veterinarians for vaccinating pets more. That's not a thing. If you've heard that, it is absolutely not true. Vaccinations in clinics are charged the same way other treatments and medications and procedures are in a vet clinic. And so any type of profit from those is the exact same as anything else that your veterinary office is doing. So the vaccine companies are not rewarding veterinarians for giving their vaccines. That does not happen. So I've heard that. So please believe me when I tell you that it's not true. That's not a part of being a veterinarian. When we booster vaccines after the initial puppy or kitten series depends on a few factors. I sort of want to focus on rabies today when we get into the nitty gritty of the vaccines. We'll get into the others later. But so for rabies specifically, there are some state laws that differ. Some states are more strict about how often rabies needs to be boosted and how strict they are about the timing of those boosters. What I mean is, when a veterinarian gives a rabies vaccine, that certificate that says this dog or cat is protected from rabies, it's either one that expires in 1 year or 3 years. And this is another point of controversy. I've seen some pet health grifters talk about like, oh, this is some secret. Did you know that the 1 year rabies and the 3 year rabies is the same vaccine? Yeah, it is. We are not hiding that from you. The reason there are 1 year rabies vaccines and 3 year rabies vaccines has everything to do with labeling from the vaccine manufacturer and the actual certification, the rabies certificate. Is it a 1 year or a 3 year? And those are determined based on state regulations. And there are very strict regulations about rabies, and that's because rabies is a very serious disease. It's completely fatal in humans and pets. Once signs of rabies begin, neurologic signs, it is fatal. And so this is something that we don't want to mess with. This is something that we don't want to risk. And so on a government level, the U.S. is very strict about this. And that's why the U.S. has very, very few many years, no human deaths from rabies. And if you didn't know this, in many other countries in the world, mainly underdeveloped countries who don't have vaccine programs like we do here that requires that our pets are vaccinated, about 60,000 people die from rabies every year. And a lot of those cases are from dog bites. I read that in India alone, 20,000 of those 60,000 people die from rabies. And most of those are from dog bites. And that's because those pets are not vaccinated for rabies and they pick it up from wildlife and then pass it on to people. And so, another one of my soapboxes is all of these people right now who are trying to discourage some of you from vaccinating for rabies and they're trying to scare you about the rabies vaccine. To me, that's a very, very privileged take. For the most part, these are people who have only ever lived in the US and other well developed countries, and they don't know what it's like to live in a country where pets are not vaccinated for rabies. And a lot of people know people who have died from rabies. Children have died from rabies. So, it must be so nice to live in a place where there is basically no human rabies so that you know, are so flippant about the disease that you encourage people not to protect their pets against it. So rabies that's the reason there are so many laws and regulations about rabies vaccine. So anyway, okay, off my soapbox. So yes, the rabies vaccine is the rabies vaccine is the rabies vaccine. Now there are different labels for rabies. There is a 1-year product and there's a 3-year product. And the difference in labeling from the manufacturers is just that what they're putting out as a 3-year rabies vaccine has been shown to last and provide protection for 3 years. Most clinics are going to just use 3-year rabies vaccines, labeled 3-year vaccines. But when they give it for the first time for a puppy, that rabies certificate is only going to last for a year. And that's because that's what most state regulation is. The first time we give a rabies vaccine, we need to booster it in 1 year. A lot of that has to do with the type of vaccine it is, needs to be boosted in a year. But then that second vaccine of rabies in most places, can then be a 3-year vaccine. And so here in Tennessee at the practice where I work, that's what we do. So our puppies get a 1-year rabies when they're around 16 weeks old. That's their first rabies. And then in 1 year, we give another one, and that is a 3-year, which just means that certificate expires in 3 years. And so then we just vaccinate those patients or our patients after that every 3 years for rabies. How do we come up with that schedule? So there are a lot of organizations, a lot of very neutral, science-based organizations who come up with these vaccine schedules, and that's completely based on research and science and evidence and fact. And so there are a lot of studies behind this. I can help you look them up if you want. We can list them, but studies are done on pets that have been vaccinated with these vaccines to see how long they maintain the antibodies that shows they're protected. Okay. So there's a lot of research that goes behind these schedules, and the 3-year rabies vaccine schedule, which distemper parvo, we also give every 3 years after that last booster. That's well established, and that's what we do because we know that not every pet is going to maintain immunity for the same amount of time, right? They're all mammals. So it's biology. Not everything is the same. Not everything follows the rule. Not everything read the paper. Not everything read the textbook. So for some dogs, they may maintain protective immunity for 5 years. Some dogs are going to only maintain protection for about 3 years. And so 3 years is that established schedule to make sure we're protecting everybody. And so this concept of over vaccinating is just really frustrating for me because in my mind, the only way we would be over vaccinating our patients is if we are insisting that they get a 1-year vaccine every year when they could be getting a 3-year vaccine. I don't think that that's what we should be doing. And other than that, the term over vaccinating doesn't make a whole lot of sense to me. We give boosters for different reasons. But just so you know, I also had people tell me like, oh, all vets are giving rabies. Someone told me twice a year. I'm like, no, ma'am, we're not. I give it once every 3 years. So then the other part of this conversation is a lot of people are talking about titers. So we need to address titers. All right. So titers are a way to test for antibodies in a patient's system to see if they have an established level of antibodies. That means they're protected from that virus, so they don't need a booster. They don't need a vaccine. And there's a lot of people out there saying you should never vaccinate your pet. You should only do titers. And I think there's some real confusion about titers. So let's just quickly go through what we use them for. So titers there are levels of antibodies for a few viruses that we vaccinate for, that we have established titer levels for. Okay. Meaning we can get a blood sample, we can measure those antibodies, and we can say that those antibodies tell me this pet is probably protected from this virus. Now, it does not give us a T cell level. So we are really only looking at one part of their immune system, but we have established that there is a level of antibodies for some viruses, not all viruses and not bacteria, but some viruses to show us protection. So some of our core viral diseases like distemper and parvo, adenovirus, and panleukopenia in cats, those are some viruses that we have established levels for. And so it's definitely something you can talk to your vet about. If you want to avoid vaccinating for distemper, adeno, parvo, you can run titers on those. And if they're high enough, then you can probably skip a vaccine that year. They are not cheap. So depending on the lab that's used, and some are more accurate than others, that can cost you upwards of $500-$600 to test for all of those things. So most people just can't afford that. This is another sort of privileged thing. Like, yeah, like I would love to just run titers for those things in my patients every year, but most people just can't afford it. And I don't control what those labs cost. They just cost what they cost from an outside lab that we send it to. So until those get significantly less expensive, this just isn't very accessible for a lot of people. But you can do it. But the important thing to know is that titers are not very helpful for a lot of things we vaccinate for. So rabies is one people don't understand. There's not a lot of established clear levels of antibodies that prove that a patient is completely protected from rabies. And remember, antibodies are not the whole story. And that on a state level, legally, most states do not recognize titers as proof of protection. So even if you run titers for rabies on your pet and you like the numbers that they're at, if your dog or your cat were to bite someone and it's reported to animal control, then the governmental bodies are not going to recognize that titer level as protection. And so they're going to go through protocols as if your pet was unvaccinated. So it's just an important thing to realize. Titers don't work for bacterial diseases. So leptospirosis, Lyme, Bordetella, because these are bacterial diseases, the antibody level against them does not really tell us anything about if a vaccine is needed. So that's also a big misunderstanding. So yeah, titers, I like. The funny thing is a lot of these people that are talking about vaccines are saying, oh, vets want to vaccinate your pets all the time because they want to make money. Like the titers are a lot more expensive. And so I think if we look at it, like the money to be made is probably higher from titers than it is from just vaccines. And veterinarians, for the most part, are probably going to tell you if you're on a 3-year schedule for distemper, parvo, and rabies, titers really are unnecessary. Now, if you have a patient or a pet who has had reactions to vaccines and there's a specific medical reason why titers are helpful, like absolutely, we think it's really great. And titers are fine. I don't know any of my colleagues who are against titers for appropriate viruses. I think what's hard is people come into a vet office, they've read something on the internet, and they're like, I'm not going to vaccinate for anything. I just want a titer for everything. And that just isn't a thing. We can't do that. We can't titer for everything. And then they usually have no idea how much it's going to cost. But there's something that absolutely we should consider in some of our patients. And then the other thing I wanted to talk about is reactions. This is another big piece of misinformation. So vaccine reactions happen. They definitely happen. There are studies about vaccine reactions. They get reported. It's important to know that saying, oh, my dog had a vaccine reaction can mean a lot of different things. And it's very important that we distinguish these things because when we talk about a significant, serious, dangerous reaction, anaphylaxis, where we have a severe allergic reaction to this injection, is really where we talk about patients potentially passing away. And that's if they are anaphylactic and it's not treated in time. This is very, very, very rare, less than 0.05% in studies. So those are facts. It's incredibly rare. So life-threatening reactions, like I said, to these vaccines are very, very, very rare. Moderate reactions can happen where we'll have some facial swelling, maybe hives. They can have vomiting. And this is a hypersensitivity allergic reaction to the vaccine. Most of those can be treated by your veterinarian with a couple different medications. When we have patients who have those reactions, we either avoid vaccines when we can, or we pre-medicate them. And we don't see that very often either. It does happen. It does happen. This is just another plug for me to remind you that leptospirosis as a vaccine does not cause more reactions than our other combo vaccines and rabies, which is a misconception that a lot of people have. We can talk about that more in another episode. And then not a lot, but some patients also have mild, very common reactions, which is just some soreness at the injection site. They can have a little bit of lethargy. They can have a mild fever. Just like in people, when we get a vaccine, we can have a sore arm. We can feel a little under the weather. And that's because of our immune system responding to the vaccine, which really tells us it's doing what it's supposed to do. So risk of vaccines is actually very, very low. There's a lot of misinformation out there that wants to blame disease on vaccines that has nothing to do with the vaccine. I've seen it all on social media. The rabies vaccine gave my dog kidney disease. Well, no, it absolutely did not. That is completely not true. There's no evidence to support that. There's people that think vaccines gave their dogs seizure conditions. Again, no evidence to support that whatsoever. The one vaccine consequence that can have to do with cancer is a very rare complication in cats, and they're called injection site sarcomas. And they're not just from vaccines, they're from most types of injections. They're so rare, 1 in 10,000 to 30,000 cats. They cause chronic inflammation, so injections of any kind, and that can lead to tumors forming. And we call these injection site sarcomas. Again, it's injection site sarcomas, not vaccine sarcomas, because other types of injection can cause them. This is why we try to give sub-Q injections to cats in their lower limb. So if this very rare complication were to happen down the road, we can amputate that limb, which is terrible. We don't want to have to do that. But again, super, super rare. I have never had a patient with an injection site sarcoma in 10 years. I'm sure it will happen eventually, but I've never seen it. It does happen, but it's very, very, very rare. So yeah, those are the things that we see as reactions to vaccines. There's a lot of confusion about what vaccines are and what they can do and what's in them. There are preservatives in vaccines so that they're safe and sterile to give. Those components I just talked about that are in the vaccines, but I am a veterinarian. I give vaccines to pets all day, every day. And we very, very rarely see any type of reaction, and they keep my patients healthy. We do see a lot of patients with the diseases that we're protecting against with vaccines. And I can promise you that that is much more terrible than any type of vaccine reaction I've seen. In all my time being a small animal veterinarian, I think I've had 2 or 3 patients ever that actually had an anaphylactic reaction to vaccines that's thousands and thousands and thousands. And the number of patients that have had a moderate reaction, like swelling, hives, those sorts of things I don't have a number, but it's not a lot. And again, this is another thing, pets that have reactions to vaccines, that's usually going to happen in the first day or 2 from getting the vaccine. So if your pet gets a vaccination and then 2 weeks later they get sick with something else, it's not because of the vaccine. This is another big misconception. I understand the temptation to blame that, but this is when we talk about correlation versus causation. Just because the time frame feels like it could be because of the vaccine, in a lot of those situations, there's just no evidence to actually prove or even show that the vaccine caused that problem. Okay. I think this is the majority of what I want you to understand about vaccines. I guess what I would say is just kind of in conclusion, I think it's important to understand what a vaccine is and what they do and what the risks are. The benefits of vaccines for our patients, pets, very, very, very much outweigh any risk of giving those. Dogs and cats are not people, and they get themselves in a whole lot more trouble than people do as far as exposure to diseases because they, lick each other's butts and they eat poop and they put their face in the ground all the time, so their exposure to things is just so different from humans. Vaccines are really important in humans, is my personal opinion, a lot of them. But in our pets, especially, if we think about pets and their risk with vaccines and we think about it in the same exact way that we think about people, we're going to miss the mark to some degree because pets are not people. And diseases between pets can be rampant. And if you talk to a veterinarian or a veterinary technician who worked in the field before the parvo vaccine was established, they will tell you that it was a sad, sad time in the pet community here because just dogs died from parvo all the time. And we have just come so far by being able to vaccinate for all these diseases. So I know it's scary out there right now with all the misinformation that's out there. It's hard to filter through what you're hearing. My advice is to think about who's telling you something. What do they have to gain? And it's not always monetary, but it can be likes and clicks and comments and attention. But in a field like veterinary medicine, we're a bunch of veterinarians. We want our patients to be healthy. If we wanted to do something about vaccines to make a lot of money, we would tell you not to vaccinate your pets for parvo because dogs with parvo are really sick and they can produce a lot of money for a vet practice because they need a lot of care, as well as all the other diseases that we treat. So, we believe in vaccines because we have physically seen how they've helped our patients. And I think it's important. It's important for your veterinarian to be willing to talk to you about this. I think it's important for you to understand this. I think you should have informed consent. I think you should know what you're vaccinating your pets for. I think we should be using a schedule, like 3-year schedules for rabies and distemper parvo, so that we're just vaccinating as much as we need to, but not more than we need to. And I think we can work together on this and be open and communicate about it and trust your veterinarian and trust the veterinary field because 95% of us agree that this is what we should be doing. So I hope this is helpful. I hope it makes sense. If you have follow-up questions, please let me know. You can email us. You can DM us. So Dr. Molly Says Podcast or Dr. Molly Says Pod is our handle on Instagram. Mine is Dr. Molly Says. You can send me a question. I don't always see them, but you can try. We also have a link in our bio where you can submit questions. Make sure you're following us. Make sure you're subscribed. You can watch this on YouTube if you're listening. And we will see you next week for the Dr. Molly Says podcast.